So, Rob, think about your last couple of interactions with the healthcare system, whether that was a physician or a nurse or picking up a prescription at the pharmacy. Talk to me about how you felt about those experiences. Were they positive? Were they negative? Were there areas where you thought to yourself, there's a better way?
Yeah, there's definitely a better way. The healthcare system is still very much broken. We talk about interoperability, but I can provide you with a case where my wife, who was just not feeling right, she had some stomach issues, and after a couple days, she said, "I think I need to go to the hospital." So she is an ultrasound tech, and she preferred to go to her local hospital, which is a very, very small backwoods country hospital, very rural. So we would go to the hospital. They wanted to send her to a larger hospital, which is closer to a major metropolitan area. When we get to the large hospital, we assume that her records are going to go with her. And so as we're prepping before we leave, they start pulling CDs to bring with us. And I told them, I said, no, I'm pretty sure that your system, because I'm very aware of your EMR vendor, should be able to take her medical record and send it through clinical direct messaging over to this other entity. They had no idea what that meant. They gave us paper charts and CDs of her MRIs, which can't be read on another machine. So of course, when we got to the larger hospital, they said, we can't do anything with any of these. We have to rerun every test. There was absolutely no transfer of data other than the paper chart and the CD that rode on her lap in the ambulance on the ride over.
Right.
There has to be a way where we can provide patient access to their own medical record, that it can be portable enough that they can take it wherever we need to, so that we can make sure that we're receiving the proper care from a clinician without having these continuing barriers of the paper process.
Right. What is your vision for what that might look like in 10 years?
In 10 years, I think that we are making headway with the technology that's available and what will be coming in the future, where a patient has a much better experience when they either stay at home and receive care from a clinician, because it seems like we're trying to keep patients healthy and at home versus in an acute facility and in an inpatient atmosphere, and that a patient has access to their complete medical record at any time, and that they're able to share that information with any provider that they want in a simple, easy manner, that they have an idea of your past medical history, and that there's never a question in terms of where that information came from, and that it's completely 100% trusted by that entity.